Welcome to the Patient First Podcast. I'm your host, Dr. Bryan Laskin, where, of course, I'm looking to increase the influence of today's engaged dentists. I'm happy you're here, and we're going to talk about a couple stories today. That one happened to me, one happened to a friend of mine, and I think they point out something in healthcare in general and dentistry definitely that I think needs to be addressed. It's something that I've made mistakes on my entire career, and I've learned from others both the positive and the negative of how this can go down. And so my story, my personal story, starts like this. I went to a physician and I wanted to have a procedure done. So I went and saw a specialist. And that specialist said to me, well, we're coming up towards the end of the year and you're going to want to get this in so that you can get your insurance to pay for it. So we're really busy right now, but we'll rush and squeeze you in so that we can get this in by the end of the year. And I don't know about you, but when it comes to my health, I'm not looking to be rushed. I'm not looking to be squeezed in. I'm looking for the best quality of care. And the words that that specialist said that you're going to want your insurance to cover it was a gigantic assumption that was not true in my case. Obviously, I'd prefer insurance to cover it than not, but that wasn't my number one priority. My number one priority wasn't getting in by the end of the year. It wasn't having insurance pay for it, and it certainly wasn't being squeezed in anywhere. I wanted to get the best quality of care. So that specialist left the room to go check on my insurance, and I left the room and went home to call up my general physician and say, why'd you send me to that hack? Exactly what I said. And so that was my experience. Now, in my friend's case, bringing it back to dentistry, he went to have a tooth extracted. I referred him to a great practice. He went in, they had the x-ray, they had all the information, and when he went in, he got yelled at because of his insurance, because they weren't a preferred provider there. And so he sent me a note saying, you got to do a podcast about this, man, because this is not all right. I'm totally cool going to this practice, but they made an assumption that because they're not a preferred provider for my insurance, that I would want to go somewhere else other than you referred me. And obviously that was not the case. Now, luckily he didn't say, why'd you send me to that hack like I did to the physician who referred me. But the core issue I believe to be the same. What was the core issue? Well, in my case, it was the specialist. In my friend's case, it was the person behind the front desk of the surgeon's office, where they were making assumptions based on diagnosing financials or the pocketbook, the wallet. Who's going to pay for this treatment? What do people want to have done based on insurance or on that person's financial situation? And I think that this is a big problem in dentistry, and it's really hard not to do. Just like in my book, The Patient First Manifesto. If you don't have a copy, go to patientfirstbook.com to get your free copy. You just pay for shipping. But we talk about in the Patient First Manifesto the disconnect between patients and healthcare providers and how that comes to be. Well, in this case, it's actually similar, but a little bit different in that we're making up this limiting belief in our own brain based on assumptions that we're making based on somebody's insurance, maybe what they look like. I hear sometimes dentists talk about the car that the patient drives up in or the job that they have, on what type of dentistry that they'll do or not do, and who they want to pay for it. Whether it's going to be out of pocket or the insurance actually changes how a lot of dentists treatment plan. And I can see why. It's because patients drill it into our brains every day, all day long. Will insurance cover that? This sounds like it's really expensive. And over time, it's going to nudge you in a direction to do this, to diagnose people's treatment based on what you think they will want to pay for or what their insurance will pay for. And that is completely stinking thinking, if you think about it. If you take a step back, we should give everybody with the same clinical situation the same options, right? They should have the same options. Not everybody has to have idealized treatment, but they should have the same options presented to them. And that is way more difficult to do in practice than it sounds because of the way patients talk to us every day, all day long. We're going to make assumptions based on what they say. And so I believe it is time to make sure to separate your front desk, your business, your financial arrangements from your clinical diagnoses. And I know that a lot of people say dentists shouldn't talk about money, and oftentimes it's presented by consultants that dentists shouldn't talk about financial arrangements because we don't value the services we do, or somebody else is better about talking about money. I disagree. I think the reason why we shouldn't talk about money is we shouldn't care. We should present the same options. Then at the front desk, they can give the financial arrangements and go over those options in the way, and make it affordable as possible for patients to deliver whatever level of care they want. But those levels of care should be the same regardless of whatever insurance they have, what they're wearing, what job they have. They should be presented the same options, right? And so we need to separate our clinical diagnoses from the patient's pocketbook and financial arrangements, and keep those two separate, right? We want to keep those separate and separate both, so that, you could, if you were a dentist and you want to do financial arrangements, I think you could do it, but you should have the conversation about the phase treatment plan and then go directly into, well, here's what the different options cost, and here's how the different options of how to pay for it. But I think that's very hard to do, because I think if you separate them and you have the financial arrangements done separately from the clinical diagnosing and treatment planning, then it's going to insulate you from being gently nudged based on people's finances. That's why I think it's helpful to keep them separate. Some people may be able to do both, but I think if you separate them, it will make it easier for you to insulate yourself from having that influence, to be nudged to make assumptions based on somebody's insurance or their financial, something they may say that you make assumptions about their financial history, their the state of their finances. So you may make assumptions, and I hear that all the time by dentists. When they say something about a treatment plan, they tell you about the patient's life history. Oh, they just went through a divorce and blah, blah, blah. They sold their house, and they start talking about, so I presented this treatment. No, the treatment should be the same regardless, right? The financial arrangements are separate, and that may very well influence what treatment the patient can afford, but what they can afford should be separate from the treatment options that we present. And so, just like other things in life, I believe, we should look to the words of our friend Ted Lasso, from, if you like that Apple TV series, like I do. And when it comes to people's financial status and how it affects their treatment, we should be curious, but not judgmental, right? If somebody doesn't go through with treatment because of finances, we should dig into why, see how we can make things more affordable, but we should not make judgments based on their financial status, regardless of, because first of all, we don't have any of their information. More than likely, we're making assumptions to begin with, which is another way of saying we're making judgments. And it should not go into our treatment planning that we present to the patient. If we think somebody has no money, but they're missing all of their teeth, we should give them all their options, including implants and with screwed-in appliances or versus dentures. It doesn't matter what their financial status is. The same options should be presented. And it's way harder to do in dentistry than it sounds, because of the way our patients talk to us and nudge us to try to make those assumptions. So it's up to us, I believe, to fight those forces and to not let finances dictate the options that we present our patients. Thank you very much for listening, and I look forward to talking to you in a future podcast.